One is triple C, the second is cohesion concept, the third is a shield concept. So these three can act as a primary prevention or secondary prevention or in the long-term prevention of violence against doctors. So violence against doctors is a real issue now. Especially in last 10 years we have seen it's increasing, especially even in COVID times, we could see that doctors are not spared. So this is very fundamental issue which needs to be addressed. And we have to think strategies on our part at our level. So these are the three strategies: cohesion, triple C and shield. All these have been published or about to be published. So just briefly about magnitude. Violence against doctors is a global phenomena, not exclusive to Indians. It is underreported, ubiquitous, persistently tolerated and largely ignored. A recent meta-analysis showed that non-physical violence, which includes threat, non-compliance, litigations, is to a tune of 43%. This is global data, including developed countries. And physical violence is around 25%, maybe higher in India. The factors are multiple, like especially in India, medical profession is labeled as a noble profession. Doctors were expected to serve selflessly, and when public healthcare facilities are inadequate and private doctors charge fees, they are perceived as greedy or betrayal from the selfless service norm. Media adds fuel to the fire. Doctors have no power. In India, there's only one rule I feel: jiski lathi uski bhais, and we have no lathi. Unlike politicians, judges, bureaucrats, lawyers who have the biggest lathi, doctors have no unity. And doctors are often alone, not geared to handle a mob. And most people, including police, sympathize with the suffering patient. He's suffering. Somebody has died. Doctor पे FIR कर देंगे क्या हो जाएगा? Most patient ठंडे हो जाएंगे, relatives ठंडे हो जाएंगे. Most violent offenders go unpunished. That's a very big factor. So the first concept is cohesion concept. It's being followed somewhere, but it needs to be done systematically. Cohesion is coming together of healthcare professionals to ensure safety of doctors in our respective neighborhood. We have just organized this concept. The main intention behind cohesion is to act as a deterrence against violence. The offenders of violence can mobilize much more people than doctors and this team, and that's what makes them so courageous. So if a system can be made during crisis, that adequate number of people can be mobilized quickly in support of the treating doctor, then it can act as a deterrent to the perpetrators of violence. So execution needs initiative from the doctor on platform, and platform is IMA is available in most places, and next step is from the IMA headquarters. So the simple concept: each town is divided into small effective units, and each EU has 30 to 60 doctors close by. And today we have WhatsApp, so each EU has a WhatsApp group and a big town IMA group. A doctor in crisis sends SOS message to the EU group, and each member of that EU 30-60 doctor small group has to send a person immediately. The doctor can come himself, but most important, he can send a staff member, a paramedical worker, even a general duty attendant or a sanitary worker. Because ultimately we don't need experts. Doctors are anyway good, not good, brave enough. We don't need for fighting. It's just a head count. With standing with the doctor in crisis, वो 25 लोग आ गए, डॉक्टर के साथ भी 15 लोग खड़े हैं. That is sufficient. And because it's not always possible for doctors to leave work and come. So if any members fail, this is a very important part. We doctors cannot do without this. If any member fails to come or send someone in less than 3 times out of 5 SOS calls, then that member will be expelled from the EU group. This part is very fundamental for this to become a success. And the prime purpose of cohesion is to act as a deterrent against offenders of violence, not to indulge in counter violence or take law into hands. They have to just stand there and just act as a deterrence. And all EU members are part of the parent IMA group, and SMS can also flash to the parent IMA group. Whoever else can come is welcome to join, but it's the prime responsibility of that EU group to come and help the doctor in crisis. So now coming to the second principle, 3 C's, it's concern, clarity and communication. We all know this, but I'm just touching them in brief. Concern is something not to be put on posters or spoken, we concern for you. If it's there, patient will automatically come to know. And concern is not only for the ailment you are treating, overall well-being. This gets conveyed. And concern is a double-edged sword. If it's there, you will earn respect. And the most important, if it's not there, it will erode everything. So concern is so basic. The second is clarity. Transparency, I feel, is going down and down, which is very important. Because very patient has to be conveyed very clearly about 4 things. Your capability and expertise, all efforts, interventions which are done and being planned or possibly can be planned, his condition and prognosis at all times. This really helps. Because this is paramount to earn patient's confidence, and very important, even if there is a deficiency in patient service, it has been conveyed. Believe me, it helps a long way. Patient knows that I have not been cheated. Because if you have conveyed the shortcoming before starting the treatment, patient has confidence. That confidence should never be broken. Even between husband and wife, 2 friends, if you lie, the confidence is betrayed. So there lies the importance of clarity. I've written a quote that you might be as intelligent as Einstein, but never underestimate the intellect of other person. Never try to fool anyone, because you can't. So that's a very basic fundamental. Never try to lie that you can do this, you can make patient fool, because if you are honest, patient will understand it. If you are dishonest, patient will definitely understand it sooner or later. And once that trust is broken, then we all know what happens. So clarity may be less beneficial in short term, but extremely beneficial in long term and preventing violence and litigations. So communication is a basic fundamental 3rd C, fundamental trait for good relationship. And most important, it is to enforce the first 2 traits. If there is no communication, if you have concern, you have transparency, but you are not failed to communicate, it doesn't help. So it is a skill which most doctors, all doctors need to develop. In COVID times, even afterwards, I got so many calls. Sir, patient ICU में है, doctor बता ही नहीं रहे क्या status है. And this, I talked to so many doctors, ICU in charge during COVID times, even afterwards. Headgear पहना हुआ है, we don't have time. And this is disastrous. Patients' relatives don't know the status. After 10 you tell them that patient has died. You know what kind of impact that's going to have on relatives. The easy thing is you don't have to tell each and everything yourself. Depute a person. You tell him 2 words. This patient, prognosis is good, doing better. Then let that person explain in 15 minutes to the relatives. All queries of the relatives have to be answered. Let that person answer. If he doesn't know, he can call you and answer that query immediately. But not answering, not talking is a recipe for disaster. So that is a very important thing. This we shortly overview that ailment, overall well-being is concern, patient's capabilities, efforts and prognosis and condition is clarity, and then communication. So we published this, that litigation is not linked to money charged, but if these 3 C are adhered to strictly, believe me, a lot of litigation and violence can be mitigated. So the 3rd step which we have started is SHIELD. SHIELD is a simple concept, and it's a website as well as a mobile app. It is only to be used by healthcare professionals, HCPs, healthcare professionals. One of the root causes of violence is not accountability of offenders, and SHIELD primarily targets this notion that it acts by creating fear in the mind of offenders that their inappropriate actions would not go unaccounted. That any violence by an offender will be disseminated to all healthcare professionals across the country, and it will make their treatment more difficult in future. But the prime purpose is again deterrence. It is not main aim is not to hinder the treatment of offender. That is unethical. But create fear in his mind that there is a potential possibility that if he does something like this, then it will be known to every other doctor and hospital in the country. So this was done after extensive research, after consultations with experts in ethics, legal field and IT sector. And the basic purpose is that we share the details of person resorting to violence with every healthcare professional across the country, so that every treating doctor can check the credentials of any patient coming to them for admission or surgery, and they become aware and take necessary lawful action. Because the main idea behind is deterrence to violence, not to make the patient suffer. So it's 2 steps, very simple. Registration is free, only once, take about 5 minutes. I will show you the demonstration. And the daily usage is free again, very simple and very user friendly. So registration, any doctor or all doctors and all healthcare professionals, be nurse, OT technician, paramedical staff, BMS doctors, everyone can do it. Basic information is required. You just require an Indian cell phone because you'll get an OTP to confirm it. And there are certain terms and conditions because they are to protect patients' privacy rights and to ensure that no legal or ethical laws are breached. Then reporting and searching, that's in daily usage. Once you have registered, there are 2 steps, reporting and searching. Reporting is that whenever some patient or his relatives resort to violence, you have to just enter 2 details about that patient or the person who is doing violence. One is the name and cell phone number, another basic details. No medical history, no private details, just cell phone number and name. Aadhaar we cannot use as per IT Act laws. And the second is the misconduct categories. Whether the patient was non-compliant, this is an important factor. Payment issues, patient ran away without giving payment, verbal abuse, threat, physical violence. There are 4 grades, just damaging property, to injuring someone or seriously injuring someone, and unnecessary litigations. A patient comes to you, you know beforehand he is resorting to unnecessary litigations. And no patient medical or sensitive data has to be reported. So in reporting section, only 2 things, and Aadhaar number we cannot use. So patient identity is linked mainly to cell phone. We all know cell phone can be changed, but still it's a cumbersome process. And so the cell phone was the closest thing we could come across as a unique number. And along with that, the person who is reporting is also, his contact is, or email is also shared along with, so that the person who is treating can talk to that person for clarification. The second component is search section. When patient comes to you and you want to see the credentials, so you put the cell phone number and you can see, oh, this patient has already done some violence or something wrong. And then you can talk to the person reporting healthcare professional what he did. And then if you are convinced, then you can take the necessary action. Necessary action has to be like what is permissible within law, like taking written assurance, referring patient to higher center diplomatically, but the most important thing, do not do anything illegal or unethical. This is a small video.
Thank you, Dr. Pankaj. I would like to add
Just
whatever
just 2 minutes. Video. Just demonstrate